Hello. So this evening, I'm going to be discussing how um, religion and spirituality impacts individual decision when it comes to abortion. Um, and this relates back to social work because as social workers, it's important that we understand the religious and spiritual side that our clients are coming from. Um, in regards to their medical decisions, especially abortion, but it's also important that we look at the health risks that this could implement. Um, so to begin, there are many religions that are very common in this day and age that don't approve of abortion. Um, the umbrella term of Christianity and Catholicism, um, most of the time, do not support abortion with any limits. So that means that no matter the circumstance or the mother of or the child, abortion is not usually accepted. Um, there are many people that are within these religions that believe that the Bible states that abortion is murder. Um, so, with this outlook on abortion and this tough medical decision, it's important that risk factors are looked at and if patients are getting the proper information from hospitals. So, one of the things that I researched was if indeed religion does impact people's viewpoint on abortion. And a couple of the articles that I found, my scholarly sources did indicate that, um, especially Catholicism and Christianity, most people were not in favor of an abortion under any circumstances. Um, Other religions that are less common that are in favor of abortion under some circumstances, it must be like a medical emergency. The mother must be at risk, and it can't be for no reason. Um, is what I found. Um, and so going back to the risks of religion impacting people's medical decision regarding abortion, there's lots of risk factors, especially for social workers, because as mentioned before, we want to support their religious decision to not receive an abortion, but it's also important that the risk factors are looked at. And the risk factors that were researched and read up on during this process were that if an individual does not believe in abortion or that their religion will not allow it, this can put the mother's life at risk if there's something wrong with the fetus or how the fetus is growing inside of the mother. This can affect the mother's life. So it's a tough conversation to have with a client if they are against having an abortion and they have these risks. So it's a toss up on what to do in this type of circumstance. So another risk could be that a patient might go to a hospital looking for an abortion if they are for abortion, looking for an abortion at a religious hospital that doesn't provide abortions. And one of the articles that I read discussed how um, in the small case that individuals' religion doesn't affect their choice, which would be if their religion seldomly accepted abortion under certain circumstances. For example, if the mother's life was at risk and she went to a hospital that was a Catholic or Christian hospital, she could be refused the service, which could result in her losing her life. Or needing to be transferred to a different hospital. Um, which can delay medical services. So there's lots of risk factors that have to do with religion impacting and not impacting. Because either way, religion is still impacting women's health and how medical decisions are supported. So I think that the best way to go about this is to support women's decisions as a social worker, religious or not religious, but to also look at the risk factors of them and their religion either influencing their decision or not influencing their decision, but still having an impact on it because the supports that they need might then not be in favor of an abortion. Therefore, she might not be able to get her services. I think that's it. Thank you.